And I am rolling.
All right. Did you have anything you wanted to start with, Dr. Beilenson, before we
No.
get underway? Okay, so why don't you talk to me a little bit about this change in mindset, both with the 14-day protocol and just more generally, the shift in how we're treating COVID-19.
So we're switching from containment, which is quarantining people who have been exposed to people who have the illness or who have traveled recently, as well as contact tracing, which is tracing their contacts backwards, to mitigation, which is trying to reduce the risk to the population that's most at risk from this virus, which are seniors and those with chronic underlying conditions.
Got it. So is it sort of an admission that this is spreading throughout our community,
Yes.
and it's not worth trying to hunt down where every case came from?
That's exactly the case.
Got it. That does not mean, though, if you're sick that you should be out in public.
No, and it's very much like guidance for the flu. So for example, if you have, whether or not you test for positive for the virus, if you feel sick, you have a fever, cough, shortness of breath, you should stay home from work or from school. If you have sort of serious symptoms, you should call your doctor or urgent care center ahead of time, so that if they want you to come in, they have you come in like through a side door or through a side exam waiting area, just as they would with a heavy flu season. And if there's imminent danger to life or limb that you feel, then you should go to the hospital or the emergency room just as you would normally.
Yeah. So does this mean that containment isn't important, or?
Containment is important, and particularly when it comes to trying to protect those who are seniors and underlying health conditions. So for example, we have mass gathering information and nursing home information and things like that. So for example, if there was an AARP conference, I don't mean to pick on the AARP, but if there was an AARP conference that had 100 people that were coming to town, we would probably recommend against that, having that, because their seniors and chronic underlying conditions would be overrepresented. Whereas a high school gathering, we might say that's fine, particularly because they're young, they're healthy, and young people, it's now been well shown by the viral life cycle, if you will, that it does not severely affect kids virtually at all. So we're kind of, the containment is on a sort of case-by-case basis. And then for seniors particularly, we're recommending that they stay home, that they avoid places with a lot of folks like the malls or grocery stores. If they're gonna go to a grocery store, do 2 or 3 weeks of shopping at a time, so you can keep things at home and avoid having to go out a lot, and those types of things.
What do you, how much time do you spend worrying about sort of public confusion on this? Because people are hearing headlines from abroad, from even other parts of California, right, where you have all big venues shut down,
right,
and yet we have sort of a different protocol here.
Well, we have some of the jurisdictions in the state have more conservative edicts. Others have more
maybe permissive, is that?
Yeah. Different jurisdictions have different guidelines, which is why we're working with the UC system to come up with a concrete set of recommendations. But we think this is a very reasonable approach, and it's a reasoned approach as well, in that I've been doing this for 25 years. Every 4 or 5 years there's a new virus that comes on the scene. It's always a virus as opposed to an antibiotic, as opposed to bacteria where there are antibiotics that can treat it, because there are no medications that can treat these viruses, and they don't have immunizations. They come on the scene once every few years, like West Nile, H1N1, et cetera, and they come on with a big bang, and then it turns out that a lot of people got the illness and were actually mild or moderate symptoms or no symptoms whatsoever. The death rate is actually very small, and it becomes part of the annual constellation of infectious diseases going around the world on a seasonal basis. And H1N1 is a perfect example of that. It is now, with an immunization available for it, and antiviral medication, is just one of the flus that goes around the world every year.
Yeah. What do you tell folks, though, that are wondering, San Jose's arena is shut down. We've got a Kings game tomorrow, and it's being allowed to go on.
Yeah.
Why the disconnect there?
I honestly don't know. We're trying to be as evidence-based as possible. And we're, again, working with the UC system to make sure that we're on the same page, and if everything that I know of, we are on the same page with them. So they're making the same recommendations that we are.
Well, they're canceling all events for the rest of the month.
No, the University of California is.
What's that?
The University of California hospital system.
Oh, I see what you're saying. So it's just different health officials making different decisions right now?
I don't think Peter wants to speak for other health officials.
I won't speak for other
No,
health
I guess
We can only talk
people
about
here are
our
going to want to know
jurisdiction.
why ours are going on when other places
Yeah.
are shutting down just down the highway.
Uh, Again,
I think not every jurisdiction is going to have the same recommendation.
Yes.
Every jurisdiction looks at what's in their community and makes a recommendation based on
Yeah.
Okay. So
And mitigation is the key here. The key is we're trying to protect, we know now from a lot of international data, there's weeks and weeks and weeks of international data of thousands and thousands of cases around the world as to who are most affected by this, and that is very clearly seniors and those with underlying health conditions. And so we're doing everything we can through our efforts and our recommendations to keep them from being exposed, whereas young people are not anywhere near as badly affected. In fact, there haven't been any deaths in young people to date, so that they can have more open access to venues, with the one caveat being that if they're sick, they should stay home, not just to protect other kids in the neighborhood, but their senior relatives and those that may be at nursing homes or their grandparents at their homes. So they shouldn't visit their grandparents or their senior citizens.
and it's true
Just a couple more
when symptoms are at their worst is when you're most concerned about spread.
That is true, although there is spread available. You can be shedding the virus without symptoms, which is again why you kind of give up on containment and go to mitigation.
Got it. How many senior centers have cases in Sacramento County? Right now?
Maybe one.
Okay,
Maybe one.
this is that Carlton Senior Living in Elk Grove.
I'm not commenting on specific places.
You can't confirm whether they're
No.
a place, but you might have one right
We have one.
Is it a presumptive right now? Is that why you can't confirm it?
It's an actual one.
Okay, so there is one positive
Correct.
case in a senior facility. Right?
Correct.
Okay. And what's being done at that facility?
Extra cleaning. They're wearing masks. They're making sure that any staff that are ill or have any symptoms are excluded from the building. They're doing a whole range of things in terms of cleaning up the place. So we're comfortable with what they're doing.
Got it. But this is not. There's no guidance that says all these senior facilities need to just flat out not allow visitors. That's not happening, right? Or am I wrong about that?
That may be not true. The senior centers that I visited so far all have signs up, all with our guidance, which is pretty impressive. And for example, at one of the senior centers, they're screening everybody that comes in at the front desk. Anybody who has any symptoms or has been on travel at any time recently are excluded from the building. And staff do extra cleaning, and the outings for the senior residents are discontinued.
Got it. So they're trying not to let sick people into the building.
Correct, and to keep their seniors from being exposed to other people if they went out.
By going out.
Correct.
Got it. I mean,
One more question.
the one
Last
where you
question.
have the positive case, are they locking down that facility so that it doesn't spread? Are people being told to stay in their rooms?
That I don't know. It's just literally happened yesterday.
Okay.
Anything else you think folks should know?
No.
We'll have the
how-
FAQs and everything on our website, and you
Yeah.
can call me with any follow-up questions, and I'll help you with those.
All right.